All right, sorry about that. We got interrupted. So basically, if your bones are growing, your ALPs are going to be elevated. If you have any questions, feel free to email me again. This one's a little bit more complicated to understand, but the alkaline phosphatase is a good indicator that bones are growing. If it's elevated, it could signal that we have some abnormal bone growth going. So we've got some bone tumors. We could have also rickets, osteomalacia. We have a bone growth deficiency, so our bones are going to be constantly trying to grow. That's where we're going to see that increased ALP. Again, increased ALP is normal for younger children and anyone who's basically not done growing. Um, so for a 13-year-old, would you expect to see an increased ALP level? Absolutely. We should probably, definitely look at that they're just having normal bone growth, right? It's just normal. Um, okay, so now let's get into some imaging. Arthrography, this is the diagnostic examination of a joint to evaluate and diagnose joint conditions. So right here we can see a shoulder. This is going to be a lateral view. And in here, this is the head of the humerus, and this is the neck. And right here on this white part, we can actually see a labral irregularity. And this is probably a good indicator that there is some type of tear, but we had to inject dye into the joint space in order to see it, right? So arthrography, it can be indirect. We're going to inject that contrast material into the bloodstream, or it can be direct, where we're going to inject the contrast material directly into the joint. Right, so Miss A, what's contrast material? Contrast material is just going to be a type of dye, so to think. It's going to be something that's going to show up on that CT, MRI, or fluoroscopy. It's a really good way that our radiologists can see and detect what's going on. So there are three ways which we can look at arthrography, and that's with a CT, a computed tomography scan, an MRI, magnetic resonance imaging, or fluoroscopy, which is a really cool X-ray. Google it or YouTube it, really. It's pretty interesting. Okay, so bone mineral density test. This is going to use imaging to measure bone mass or mineral density. So there's two types of machines. We have peripheral machines, which are going to measure bone density in the wrist, the fingers, kneecap, shin, heel. So all of those smaller appendages. Peripheral machines are lightweight. They're fairly portable. So they're going to be smaller machines. But if we need to look at the body as a whole, we're going to use a larger machine, which is a central machine. So that's going to be those hard to read areas like the hip, the spine, or even the whole body. This one is really cool. So the bone mineral density test, I forgot to say this, but it's kind of on the out because we have better technology now, right? This was one that was discovered in the 70s, and while it is useful, we have better equipment now. And one of those things is this DEXA, this dual energy X-ray absorptiometry. I know I'm saying that wrong. Scan. A DEXA scan is really cool in the fact that it's a high precision type of X-ray. It's going to measure bone density and bone loss. It's going to be a bit more accurately than a bone density, than just that regular bone mineral density, that BMD test. So this is going to be kind of the newer wave. It's actually gaining a lot of momentum in the health community because if you look at these two scans, so white is going to be bone, and we have some orange that's bone as well. If you look at the ribs, orange is also going to indicate muscles, and then if you look for the yellow, that's going to be fat or excess skin. So here we can actually look and have a really good in-depth view of body composition. So this is going to be super important for the health field. And I say health as in exercise, wellness. Yeah, they actually love these scans and they're putting them on the rise. But for our purposes, for our skeletal system, we're looking at bone mineral density and bone loss. So what it does is it takes your values and compares them against someone that is just like you. So someone with the same sex, age range, race, they're going to compare your values against the average peak bone density of someone just like you. And they are going to use it to diagnose osteoporosis. So DEXA scans, osteoporosis. I want you to go ahead and make that connection. Okay, so next we have photon absorptiometry. This is a bone scan which uses a low beam of radiation to measure bone mineral density and bone loss, particularly in the lumbar vertebrae. This is one that's going to be very useful in monitoring osteoporosis. And we can see like the green lines right here. I mean, it's legit a scan. It's going to fire photons. So it's going to send low radiation through a patient and take an image. Okay. X-rays. X-rays are examination of bones using electromagnetic waves of high energy produced to identify fractures and other pathological features, just like RA, spondylitis, and tumors. So this is a typical X-ray vision. We're actually looking at a giant cell bone tumor. So here we can really see it on the lateral view. This hole right here, this circular space, this is that giant cell bone tumor, and it exists, and we can see a little bit of it here as well. So if you notice with the x-ray, we get really nice clean lines because that's why we're sending that high energy, that radiation using quite a bit of energy. These are relatively safe for patients, but over time we do have a risk of radiation poisoning. So next thing we're going to get into are treatment options. There's a lot of different treatment options for skeletal system diseases. I'm going to talk about a couple of them as we go. All right, so let's first start off with medications. The stuff in red is really important. Excuse me. I am going to really just kind of influence the stuff in red. I'm not going to be, you're not going to be responsible for knowing specific medications, but I do want you to know what the drug class and what it is. So when we talk about drug classes, we're talking about this bolded part right here. We're going to talk about, first we're going to go with, so most bone diseases have a inflammatory type of response to it. Osteoarthritis, rheumatoid arthritis, hydroarthritis. What other ones have we talked about? Gout. So there's an inflammation response. So in order to combat that, we need a anti-inflammatory agent and a type of NSAID or a non-steroid anti-inflammatory agent. Anti-inflammatory agents, they're going to relieve swelling, tenderness, and inflammation. Examples, Depo-Medro, ibuprofen, naproxen. These are going to be over the counter, except for Depo-Medro, but we know we can get ibuprofen and naproxen over the counter. However, when you see patients or these patients are taking these medications, they're typically going to have a prescription strength. Okay, we also have what's called DMARDs. These are disease-modifying anti-rheumatic drugs. This is specific to rheumatoid arthritis. They're going to influence the course of disease progression. Again, DMARDs, no rheumatoid arthritis. These are typically very expensive medications. We also have COX-2 inhibitors. In inflamed joints, there is an enzyme. COX-2 inhibitors inhibit that enzyme from more inflammation. So that's going to be your Celebrex, meloxicam. Again, COX-2 inhibitors, they're going to inhibit COX-2. COX-2 is an enzyme. With osteoporosis patients, think back, we see osteoporotic patients. Those are typically going to be those females after menopause.